Mounjaja journey and you are feeling absolutely ravenous and you've only just started, then listen up, because here's the reason why. Those of you that don't know me, my name is Tiff. I'm down over 100 pounds on a Mounjaja journey in 13 months and I am a qualified naturopathic nutritional therapist. Every day I come on to share hints and tips and tricks and what works for me and what doesn't. I'm always real, raw, open and honest, so if that sounds like fun to you, drop me a follow. Just remember that these videos are for educational purposes only. Always consult your own healthcare practitioner. So I hope that this lovely doesn't mind me using their comment, because a lot of people have asked the same question, so I thought let's do it in one fell swoop so that it helps the most people. This comment says, I'm on it for 1 week and I'm still hungry like always. I literally don't feel anything. Is that normal? Because I'm starting to panic. First things first, with Mounjaja, first dose is 2.5 and that is termed a loading dose. The whole purpose of this dose is to just get your body ready for the medication and get your body used to it. Allow your body to metabolize it. Hopefully there won't be any side effects or any adverse effects or anything like that. And just to make sure that you can actually tolerate this medication, because, you know, as always, there are some people that can't tolerate all medications. So that is the only purpose of this 2.5 loading dose, i.e. the first dose of Mounjaja. Probably what people don't realize, because a lot of providers fail to tell people this, that more often than not, people don't feel anything at all on that loading dose. I was just a really, really lucky person and what is termed a super responder. So I felt it within 1 hour of that first injection over 13 months ago. I dropped loads in 16 weeks on 2.5 before I then moved to 5, because I felt everything returning again, like the food noise and everything returning again in my PCOS symptoms and blah, blah, blah. I am quite an anomaly. Now, you will find lots of other people in the community that have actually managed to lose more than me, even 2.5. They've never had to go any higher. They are super responders. But very, very unfortunately, that is not the typical thing. That is not the typical scenario at all. Most people will not feel anything. Most people won't feel anything on 2.5, 5 or 7.5. If you've had insulin resistance and chronic obesity for a long period of time, which most of us have, it's going to take a little bit more for your body to actually go, okay, this is what we're doing. Insulin resistance is such an immense metabolic syndrome. It can take a while to build up to the therapeutic amount of medication that's actually needed in order to get your weight moving again. Now, this is where I feel that there's a really big gap within this sector, because a lot of providers just don't tell people that. So people, of course, they think they're going to take 2.5 and they think that they're going to drop loads and they think that their food noise is going to disappear. And for some people like me, very, very luckily, it did. And yes, I dropped a lot on it. But for most people, they don't feel anything. I think that actually there should be more information available out there that lets people know that they probably won't feel anything on 2.5, 5, maybe even 7.5. They might not feel anything till 10, 12.5 or 15. There are some doctors out there that try to get some patients as quickly as they can to 10 and above, because they are super therapeutic for certain conditions. Now, of course, this is different for everybody. But yes, just to remember that if you're thinking, I expected everything to just happen immediately, that's probably not going to be the case for the majority of people. Over 70 to 80% of people, statistics wise, research has shown, don't feel anything at all on 2.5, because it is the loading dose. So if you are on the loading dose, you're like, this shit ain't working for me. Give it 4 weeks. If after the 3rd week, before you take your final one, speak to your provider, and if it isn't working for you and nothing has kicked in yet, the food noise is still crazy, you're still ravenous all of the time, and your symptoms haven't kind of dropped down at all, then speak to your provider about moving up after the 4 weeks to 5. Yes, we want to stay low and slow for as long as possible, not at the detriment to our actual weight loss journey and not at the detriment to our health and to reach our goals. Of course, it's also really expensive. So one thing to consider if you are thinking about going on to this medication is that this could take years. It could take years. It might take you 6 months. It might. But for someone like me that had 16, 17 stone to lose when I started, hundreds of pounds when I started, it's going to take me years. I'm interested to know, were you a super responder? Did you lose loads on 2.5, or did you lose fuck all and had to wait till you got to 5, 7.5 and 10 before it really started to kick in for you? Let me know in the comments, because I'm always interested to see what other people's journeys are. As usual, if you have any questions, drop them in the comments and I'll do my very best to answer them.